Brain tumors are abnormal growths of cells in the brain or near it. They can be benign, which means noncancerous, or malignant, which means cancerous. Brain tumors can cause various symptoms depending on their size, location, and type. Some brain tumors may not cause any symptoms until they are very large, while others may cause symptoms that you notice right away. In this video, we will explain 8 signs of brain tumors that you should be aware of. Make sure you watch the video until the end. Let's get started. Number 8. Headaches. This is probably the most common and well-known sign of a brain tumor. But not all headaches are caused by brain tumors, so don't panic if you have one. Brain tumor headaches tend to persist for more than a few days, and they are usually associated with nausea or vomiting or occur early in the morning. This is because the brain tumor may increase the pressure inside the skull during the night when you are lying down. Headaches caused by brain tumors may also get worse with coughing, sneezing, or changing positions. Number 7. Seizures. A seizure is a sudden episode of abnormal electrical activity in the brain that can affect your movement, sensation, behavior, or consciousness. Seizures can be caused by many things, but a brain tumor is one of them. A tumor can make your brain's neurons fire wildly, leading to seizures. Seizures can vary in type and severity, but they usually require medical attention. Number 6. Vision problems. When a brain tumor presses on the optic nerve, which carries visual information from the eye to the brain, or on other parts of the brain that are involved in vision, it can affect your vision. So you may experience blurred or double vision. It may also cause loss of peripheral vision, or even loss of vision in one eye in some cases, if the tumor is aggressive. You may also have trouble seeing colors, shapes, or details. Most of the time, visual problems can be subtle, but they should not be ignored. Number 5. Nausea and vomiting. One of the signs of a brain tumor is nausea and vomiting that is persistent or worse in the morning. This can happen because the tumor increases the pressure inside the skull, which affects the balance center in the brain and triggers nausea. It is important to remember here that nausea and vomiting are common symptoms and can also be caused by other conditions, such as migraine, food poisoning, or pregnancy. So it is important to rule out other possible causes before suspecting a brain tumor. Number 4. Balance and coordination problems. Balance and coordination are controlled by a part of the brain called the cerebellum, which is located at the back of the head. The cerebellum helps us maintain our posture, walk smoothly, and perform fine movements with our hands and fingers. When brain tumors damage the cerebellum, either by pressing on it or by affecting its blood supply, they can cause symptoms such as difficulty walking or standing without falling, trouble using utensils, problem with writing or typing. You may also have slurred speech or difficulty swallowing, numbness or weakness on one side of the body, and dizziness or vertigo. These symptoms can be very frustrating and interfere with daily activities and quality of life. They can also increase the risk of falls and injuries. Number 3. Hearing problems. One of the possible symptoms of brain tumors is hearing loss or ringing in the ears. This can happen if the tumor is pressing on the auditory nerve, which carries sound signals from the ear to the brain, or if it is affecting the parts of the brain that process sound. The hearing loss here can be partial or complete, in one ear or both. Sometimes people with brain tumors may also experience dizziness, balance problems, facial numbness, or weakness. Number 2. Memory problems. Brain tumors can cause memory loss or impairment. This can happen because the tumor presses on or damages parts of the brain that are involved in memory formation, storage, and retrieval. For example, the hippocampus is a structure in the temporal lobe that is essential for creating and recalling memories. If a tumor affects this area, it can cause problems with short-term memory, such as forgetting names, dates, or events. Memory problems can also occur because of the treatments for brain tumors, such as surgery, radiation therapy, or chemotherapy. These treatments can damage healthy brain cells and cause inflammation, which can interfere with memory processes. Sometimes, memory problems can improve after treatment, but other times they can be permanent or worsen over time. Number 1. Personality or behavioral changes. You may be surprised to hear that a brain tumor can cause personality changes, but it is actually true. Your personality and behavior are influenced by many factors, including your brain. A tumor in certain parts of your brain can alter your mood, emotions, thoughts, and actions. You may become more irritable, apathetic, impulsive, or aggressive. You may also lose interest in things you used to enjoy or have difficulty making decisions. Personality or behavioral changes can be hard to notice by yourself, so pay attention to how others react to you. So, these were some of the common early signs and symptoms of brain tumor that you should not ignore. If you experience any of these symptoms, especially if they are persistent or worsening, you should talk with a doctor as soon as possible. If your doctor suspects that you might have a brain tumor, you will need to undergo some tests and procedures to confirm the diagnosis. These may include: Number 1. A neurological exam. This is a test that checks different parts of your brain to see how they are functioning. It may include checking your vision, hearing, balance, coordination, strength, and reflexes. If you have trouble in one or more areas, this may indicate that there is a problem in a specific part of your brain. Number 2. A head CT scan. This is an imaging test that uses X-rays to create pictures of your brain and skull. It can detect problems in and around your brain, such as bleeding, swelling, fractures, or tumors. Number 3. A brain MRI. This is another imaging test that uses strong magnets to create detailed pictures of your brain. MRI is often used to detect brain tumors because it shows the brain more clearly than other imaging tests. Sometimes a dye is injected into a vein in your arm before an MRI to make the pictures clearer and easier to see smaller tumors or differentiate between tumor and healthy tissue. Number 4. A PET scan of the brain. This is a type of nuclear medicine test that can detect some brain tumors. A PET scan uses a radioactive tracer that is injected into a vein and attaches to tumor cells. The tracer makes the tumor cells stand out on the pictures taken by the PET machine. Cells that are dividing and multiplying quickly will take up more of the tracer than normal cells. Sometimes the only way to make a definitive diagnosis of a brain tumor is through a biopsy. This is a procedure where a small sample of tissue is taken from the tumor and examined under a microscope by a pathologist. The pathologist can determine whether the tumor is cancerous or noncancerous and what type and grade it is. A biopsy can be done during surgery or with a needle through a small hole in the skull. As for the treatment, it depends on many factors, such as whether the tumor is cancerous or noncancerous, its type, size, and location. Sometimes if the tumor is very small, noncancerous, and not causing any symptoms, then you might not need treatment. But generally, that common treatment options include: Number 1. Surgery. This is an operation where the neurosurgeon tries to remove as much of the tumor as possible without damaging the surrounding healthy brain tissue. Number 2. Radiation therapy. This is a treatment that uses high-energy rays or particles to kill tumor cells or stop them from growing. Radiation therapy can be given externally from a machine outside the body or internally from radioactive sources placed inside or near the tumor. Number 3. Radiosurgery. This is a type of radiation therapy that delivers a high dose of radiation to a precise target in the brain with minimal damage to nearby healthy tissue. Radiosurgery can be used to treat small or well-defined tumors that are not suitable for surgery or conventional radiation therapy. Number 4. Chemotherapy. This is a treatment that uses drugs to kill tumor cells or stop them from growing. Chemotherapy can be given by mouth, through a vein, into the fluid around the brain and spinal cord, or into an artery that leads to the tumor. At the end, brain tumors are serious conditions that require immediate diagnosis and treatment. So if you have some of these symptoms, don't ever hesitate to talk with a doctor. Thanks for watching.